Well, ladies, if you've had children and are experiencing some uncomfortable symptoms like incontinence or lack of sexual sensation, there's a treatment that may help you. I want you to meet Dr. Vanessa Dean. She's with SottoPelle, and she's here to talk about what she calls, I love this word, female fitness. And she's here with Susan Schaefer, who's been a client. It's had success. Welcome to both of you ladies.
Thank you.
Okay, so Dr. Dean, tell me about this treatment. It's called Genevieve, and it's different than some of the other ones we've heard about. What does it do?
So Genevieve is a radiofrequency treatment that's used to treat both vaginal and bladder concerns in women.
Okay.
It uses radiofrequency to help with bladder control, so essentially stress urinary incontinence, or what we call leakage, laxity, which happens after childbirth or as we age, really, lubrication, and with laxity and lubrication issues come sensation issues.
So what makes this a little bit different than some of the other treatments that we talk a lot about is that this is just one treatment.
Yes. Which is very, very nice. This is one treatment. It takes about 20 minutes, start to finish. We book a 30-minute appointment, and results can last years, actually.
Wow, that's pretty amazing. And you do the treatments,
I'm the one that does the treatment.
Okay, so Susan, I want to hear your story here. So what happened was you were obviously very fit, you work out a lot, and you were experiencing some leakage, and how long was that going on?
Oh, it's been a couple years. And I just thought it was something I was going to have to just live with, you know, just deal with it. And then I was in the office at SottoPelle, and I picked up a pamphlet on the Genevieve. Started reading about it and thought, you know what, this just might be what I need.
Wow. Now, had you considered maybe surgery or anything like that prior to
I think
that?
it had crossed my mind, but it really wasn't something I wanted to do.
Right, right. I don't blame
the
you.
anesthesia and all that, I didn't want to try it.
And Dr. Dean, a lot of women think that that's really the next step.
Absolutely.
And maybe have even been told that. How do you know if this treatment is really going to be right for them and that it's going to work?
Sure. So there's really a large scale of stress urinary incontinence from severe to minor. So I usually sit down with the patient and tailor the treatment to them. So I try to figure out what is it that your concerns are, what is it that you specifically need, and we can actually tailor this to you.
Oh, really?
Yes.
Okay.
Yeah.
So how long ago, Susan, did you have this treatment?
Almost 3 months to the day.
Really?
Yes.
Okay. And
it's amazing. Absolutely amazing. I think after the first month I was kind of like, well, maybe it's helped a little bit, but then it just started getting incredible improvement.
Well, you said you actually had some irritation that first month, and, and it was kind of uncomfortable for you.
Right.
And is that normal, Dr. Dean?
Actually, generally speaking, most people don't feel much afterwards. They kind of go about their life and forget that they've had this done. But with Susan, we specifically focused on the urethra area, and I tailored the treatment to her to really focus on the bladder control. So we may have irritated the tissue a little bit more. It caused her a little bit more urinary frequency at first.
I see. Okay, so it's been 3 months to the day.
3 months.
And tell me, when you do all of the things that you love to do and that you were doing before when you had a problem, what's happening now?
I'm 20 years old again. There's no issues whatsoever. It's fantastic.
Okay, begs the question, kind of the side benefit is, you know, that you have, you know, better sexual sensation. And that's
it's
going to
bringing
happen.
couples closer again. A lot of women, as they age, their sexual function is going down, and I think this is an important conversation for everyone to be having.
So
really.
Did you get a 2-for-1?
I got a 2-for-1.
Yes.
Perfect. Here. All right, everybody's happy, right, Susan?
Everybody's happy, yes.
All right. Dr. Dean, Susan, thank you so much for being here, sharing that information. It's called Genevieve, and of course, when you call to make your appointment with SottoPelle, just be sure to mention Sonoran Living, and it will give you a very special offer. SottoPelle is located at 8412 East Shea Boulevard. That's Suite 101 in Scottsdale. Here's a number to call, 480-874-1515. Learn more at SottoPelleTherapy.com.